Hello and welcome to Dr. Barbara Miller's NCLEX review. Uh, the goal for today is to ensure that you are grasping the content of the review. Today we're going to be discussing thyroid disorders, hypothyroidism versus hyperthyroidism. Okay. So the action that I would like for you to take is to start journaling your notes, because these topics often showed up on your state board of nursing. Okay, so that's what I'm going to be doing. The most common topics that often or frequently showed up on your state board of nursing examination. So we're going to start with hypothyroidism. And what is hypothyroidism? Okay, before we get into that, let's start with the thyroid. Okay, the thyroid, what regulates the body's mechanism, or the function of the thyroid is to regulate our body mechanisms. And when it start getting imbalanced, then we could run into problems. So if you were to ask, the thyroid gland is located at the Adam's, just below the Adam's apple in the neck. Okay, so that is where you would try to assess. You would go behind the patient and assess the thyroid. Okay, you do have three main hormones. Okay, you have your T3 and your T4, and also calcitonin. Okay, so let's talk about hypothyroidism. What is that? Hypothyroidism is under secretion of the thyroid gland, which could cause major issue if it's left untreated. It could be mild, where the patient is asymptomatic, patient is not experiencing any clinical manifestations. However, patient may be feeling something and do not know that this type of undersecretion of the thyroid gland could be lethal. So what are the causes of hypothyroidism? You have primary causes, and we're going to go through them. You have secondary causes. You have tertiary causes. Okay, so let's start with primary causes. Loss of thyroid tissue leading to low hormone production. Okay, it could cause by an autoimmune disease such as Hashimoto's thyroiditis, or iodine deficiency. Secondary hypothyroidism, okay, you have 5% of the cases where the pituitary gland fails to stimulate the thyroid. And tertiary hypothyroidism, where the hypothalamus fails to produce thyroid releasing hormone. So your thyroid releasing hormone is hormone produced by the neurons in the hypothalamus, and it stimulates the release of thyroid stimulating hormone as well as prolactin. Okay, so those are the causes of hypothyroidism. So you want to obtain a thorough history on patients with hypothyroidism. Just remember, everything is slow. Those patients, they have fatigue, they have slow heart rate. They normally get bradycardia. They are constipated. They gain weight. Okay, they do have joint aches, hair loss, okay, menstrual changes, and decrease in libido. Okay, so just remember, if you were to ask on your state board of nursing, hypothyroidism, okay, everything slows down. Okay, so how do you diagnose hypothyroidism? Your thyroid stimulating hormone, okay, and what is the thyroid stimulating hormone? It's a hormone that regulates the thyroid function. So the thyroid stimulating hormone will increase, and in contrast, T3 and T4 will reduce. So if you were to ask, what's the normal thyroid stimulating hormone? It is 0.4 to 4.2 milliliters per milliunits per liters rather. Your hypothyroidism is greater than 4.2 units per liter, okay? Your T4 test, if someone asks you what's the normal T4, the normal T4 is 5.5 to 12.5 microgram per deciliter. Hypothyroidism, decrease in the T4, okay, low thyroid hormone production, and the T3 also decreases. So the normal T3 is 70 to 204 nanograms per deciliter. Don't forget that. So your thyroid, they will do electrocardiogram, take pictures of the heart to ascertain if the heart is now involved, because remember, hypothyroidism causes bradycardia, okay? So it interferes with the T waves. So what's the T wave? The T waves is ventricular depolarization when the heart is at rest. Other tests that they could use to help diagnose hypothyroidism is a 24-hour radioactive iodine uptake and a thyroid auto antibodies, and also the levels. Okay, so hypothyroidism, when you're developing a plan of care, the goal is to restore your thyroid state and prevent complications. So what are some complications of hypothyroidism? It's myxedema coma. Myxedema coma, okay, it's a life-threatening situation because the patient will develop cardiovascular problems and also respiratory problems, okay? So what are the diet for hypothyroidism? You want to give them a low-calorie, high-protein diet and high-fiber diet, okay? Remember, hypothyroidism is the intolerance to cold. They're not able to tolerate cold. They are slow and they are fat. Always check the thyroid stimulating hormone for elevation and decrease in T3 and T4. You want to educate the client or the patient that they must be on levothyroxine, okay, for the remaining of their lives, Okay, levothyroxine should be taken early in the morning on an empty stomach. Levothyroxine or Synthroid must be taken on an empty stomach in the morning, early morning. Okay, so remember myxedema coma. Okay, patient has major problem with their gas exchange. Gas exchange is the inhalation and exhalation. Okay, you breathe in oxygen and exhale carbon dioxide. So myxedema coma, you will see the patient has the tongue sticking out, trying to gasping for air. Okay, so please know that myxedema coma comes with hypothyroidism, and it can be a life-threatening situation with myxedema coma. Patient needs to be treated aggressively in order to save that patient's life. And in contrast, you have hyperthyroidism. And what is hyperthyroidism? Is oversecretion of the thyroid hormone, okay, that places the patient at risk for a goiter, okay? So hyperthyroidism, also known as Graves' disease, patient will develop like a enlarged neck that is called a goiter. Patient will also have a bulging eye, also known as exophthalmos, okay, because of the oversecretion of the thyroid hormone. Patient will have tachycardia, fast heart rate above 100 beats per minute. Patient will have a thin build, increase in appetite, okay? They have an increase in appetite, however, they lost weight. They will have brittle nails, okay? Brittle hair, the hair falls out. So a patient with hypothyroidism, they will have a decrease in their thyroid stimulating hormone. It will go down or it's not measurable. They also will have an increase in the T4, okay, and an increase in the T3. They do have other tests like the radioactive iodine uptake or the thyroid antibodies. Those tests are thyroid scan. So if someone has hypothyroidism, they could drink, I think, 1 tablespoon as per prescribed radioactive iodine. Radioactive iodine will take high thyroid to low thyroid. Okay, so hypothyroidism, if the patient prescribe radioactive iodine, they could bring it down to hypothyroidism. However, they would still need to take the levothyroxine for the remaining of their lives. So what are the plans for hyperthyroidism? The goal for hyperthyroidism is to restore a eurothyroid or state and prevent complications. What are the complications of hypothyroidism? Is thyroid storm. Okay, thyroid storm, if the patient is undergoing stressful situations or the patient fails to take their medications as prescribed, yes, they could end up with a thyroid storm and need to be hospitalized, just as hypothyroidism, myxedema coma, hyperthyroidism, thyroid storm. And those two complications could be life threatening. So when you're doing your notes, if you go back on my videos, you will see uh, endocrine, and under the endocrine, you will see hyper and hypothyroidism. It is so important for you to journal your notes, okay? Write your notes. Well, they claim evidence-based or research state that when you journal your notes, you tend to remember even more. Okay? So what are the medications that they would use for hyperthyroidism? Prothyrosil, okay? Prothyrosil is one, okay? They also will use beta blockers, okay? Beta blockers, and why do they give beta blockers? Because patient with hyperthyroidism tends to get high blood pressures, okay? So please to go over all that. High blood pressure, beta blockers, prothyrosil, okay, all those medications that you need to remember for your state board of nursing. My goal is I would like to give you a comprehensive test. The last time we went over stages of labor. Tonight we going over hypothyroidism. Okay, so I would like to schedule a test to see how well you would perform, or some case studies, because the boards now, they have short case studies, okay, like the bow tie. They will give you a scenario and you are to choose what's happening with the patient. It's not as hard. So I will have that sometime as we go along. So are there any questions on hypo or hyperthyroidism? Any questions? Don't be shy. No questions on hyper or hypothyroidism. So if I were to ask you the medication that they administer to patient with hypothyroidism is that of levothyroxine. Levothyroxine early in the morning on an empty stomach. Okay? And what medication do they give for hyperthyroidism? Prothyrosil is one of the most common medication that they give for hyperthyroidism. They also will give beta blockers to help stabilize the blood pressures. So any questions? No questions at all? Okay, so what I'm going to be doing, I'm going to create a test towards the end, and then I'm going to see how well you able to answer questions. What I'm doing is to start giving you the most popular topics that comes on the State Board of Nursing. Last week was the stages of labor. You must know all that. And today you've got to know the thyroid disorders, okay? Know your function of the thyroid, okay, is to regulate the body's mechanisms. And when there's a hyposecretion or hypersecretion, the body becomes an imbalance, which could cause major health issues. It's going to impact negatively on the cardiovascular and also the respiratory status. Okay, so next week I'm going to be talking about diabetes insipidus and syndrome of inappropriate antidiuretic hormones. So we're going to go through the med-surg, the most popular topics that commonly seen on the State Board of Nursing. I've been doing this for a while. I do teach at the undergraduate right here in Palm Beach, and also the graduate where I teach the doctorate program. So you are in good hands. Been practicing for over 40 years. So if you have no questions, okay, no questions at all, the action that I would like for you to take is for you to start journaling your notes. Okay, write your notes. I do have a whole lot of different videos. Okay, so go in and find the one that under endocrine system, because hypo and hypothyroidism is part of the endocrine system. Okay, that secretes the different hormones. Okay, any questions? No questions. All right, so we're going to end the live. And don't be shy. This is my second time doing the YouTube channel. So I'm getting to understand the live more. So next week we'll stay on endocrine. We'll talk about diabetes insipidus and syndrome of inappropriate antidiuretic hormone. Diabetes insipidus has nothing to do with diabetes mellitus. Let's remember that. No questions? Okay, so see you next week, the same time. Next Tuesday, we'll have another live. Okay? All righty, good night.